Hi, my name is Hussein Kazbadi, and these are the around four, hopefully you can hear me, four individuals that are in my group that we are going to present our case and why we think this is an important case and something that shouldn't be let down, especially in the healthcare uh, field. So we got Natalie Nguyen, who is the project and the presentation designer, and we got Ian Luong, and we got Romina DeWood. Both of them were doing a majority of the information that was in this presentation, and yeah, yeah. So they provided a lot of resources for that. And Hussein Kazbadi, me, myself, and I. I'm basically the presenter of the group, someone who's just doing the group a little bit more favor and presenting the idea itself and why we should advance in this. So we will now go to the first slide, and the first slide is bridging the gap, bridging the MRI gap. And this is why I think it's important because it's it's not only it's not only a piece of technology that anyone can have, especially in the first world countries. We will discuss that, but this is why I'll go to the next slide just before I start rambling. So we'll go to the next slide. As you can see, the MRI accessibility crisis. The reason why we don't have accessibility around the world itself globally, and the actual word is magnetic resonance imaging, but the real reason why there's no accessibility around the world globally is because of how expensive the technology it is itself to make it, to produce it, and to make it for a huge amount globally to like save lives, to predetermined diseases like cancer and like strokes and stuff. These will be very crucial around the world, especially around countries that don't have much resources or any money to even provide any technology like this. So this is why I think it's very vital that this is something that not only is provided in first world countries but also provided around the world. Just not because it's just because it's a third world country doesn't mean it shouldn't have like accessibility to these technologies, especially for healthcare, in my opinion. So everything else I could say like sure, maybe other things, maybe not. Okay. Anyways, 90% of the whole population in the world has never seen an MRI, has never heard of an MRI because it's not common. And it's very less common in majority countries around the world. And the lucky countries are the first world countries, the one with the high income and yeah, it's just the technological limitations is not it's there. It's there in those countries because we don't we haven't created something. We haven't created mobile MRIs, something that's smaller versions for those countries. Because in my opinion, you don't really need a huge MRI to detect certain diseases. Like there's much more and a much more effective way to doing it, and it's easier it's easier said and done, 100%. But I think it's more cost effective if you do make a cheaper, mobile, smaller MRI version for the whole world globally, for everyone to access and be able to learn, use it, take advantage of it. Everyone should have this technology. It's not something that should be gate kept. So these are the four improvement steps that will increase accessibility. We got multifaceted approach, increasing the finance and the resources and tech. So this is a cheaper route. And second, healthcare infrastructure investment. So increasing the resources of increasing the money that's invested into this technology to create something mobile and for people around the world, not just us. government public collaborations. So collaborations with the healthcare of different governments linking together. And this will be partnerships, and this will definitely help in the long run for that gap between healthcare globally. And fourth is training. Training and education on MRI tech. And not only MRI tech, this is only the beginning of what healthcare can do in technology, but this is a good step in the right direction. If we pursue this idea right now, the future is a lot brighter on the other side. So, yeah, I think finally the last slide. Okay. So, the plan is using those four steps, we can create and provide our future generations a sustainable future. Like, this is something that is not only going to help the current situation in the world for healthcare, it will help future generations to foresee new technology and how we can improve on it, not only just stay on the same topic of MRI, because MRI is something, it's huge, but it's a stepping stone. This is the first step where technology in healthcare will improve exponentially if we actually focus on the correct things. And financially, this should be accessible for all patients under healthcare around governments with partnerships with healthcare around the world. It should be just under one union of healthcare. And this would definitely be more flexible to patients and more easier for people to use this technology without having any repercussions of, oh, I didn't have the choice of knowing this or that. It's saddens me that people don't have this available currently. It really does. And second, community awareness and education. Investing in training programs of how to use one and how to, like, why it's so important. Three, the improved MRI and technology that will be coming will be because of this. If we really do want a sustainable future, we should definitely use this pitch. What I'm saying is very important, not only to the healthcare field, but to every individual in the world. Because this is not only something that can predetermine diseases and help you prevent them, but it can also create a friendly and more of a close to ideal life around the world. So, who wouldn't want that? And this is exactly why it's a very good long term impact on the world. The MRI is a very good, like, very good piece of tech. Four, what comes after this? What's next is creating accessible mobile versions of MRI in all hospitals, not in just one main city hospital in every country. That would be great. But what's better is when we can create MRIs that are smaller, easier, and fitted for every hospital. That's all I have to say. A sustainable future is only curated by certain decisions like this. This is a decision in the correct direction. And if you want to be forcing not only technology and science improvements in these coming years, then you definitely want to choose this. Like, it shouldn't be kept or gate kept at all. This is something very important and crucial for the healthcare around the world. And this will unify the world if you actually put this into effect. Have a nice day. Have a nice night. Thank you.